Hi, I'm Kelly. I'm Dr. Max's patient care coordinator here at Hair by Dr. Max Restoration Center. We're going to talk a little bit today about the consultation process. This is the first step to bringing back your confidence. The first consultation we offer is with me. It's a general consultation where we go over a full explanation of the different hair restoration procedures, both surgical and non-surgical. We can also go over what your medication options are. I'm not a doctor, so I cannot prescribe you any medication, but I can let you know what your options are, whether it be oral or topical medication.
Our second option for hair loss consultation would be a thorough medical examination with me, Dr. Max. During the consultation, I will go over medical history, perform necessary tests such as lab analysis or, if necessary, skin biopsy to determine the exact causes of your hair loss. We also utilize state-of-the-art artificial intelligence technology such as TrichoLAB, as you can see here in the background, that helps me as a physician to diagnose condition by taking very precise trichoscopy images. But also at the same time, I can create a 3D map of the scalp, both donor and recipient areas, and it will help me to determine how many grafts do we need. I can show how the process of building hairline works and potentially show the results that we can expect with any hair restoration procedure. So this consultation can take a little bit longer, between 40 minutes to 1 hour, and it does require a certain fee to schedule.
If you have any questions, feel free to call or text us or visit our website www.bringbackhair.com for more information.